How does biomechanics impact student-athlete return to play after injury? Imagine trying to put together a puzzle where some pieces are slightly warped or missing. That's similar to what happens when an athlete returns to play after an injury. Biomechanics is like the guide that helps us see the full picture clearly. It studies how our bodies move and the forces involved in those movements. When a student-athlete gets injured, especially in joints like the knee, biomechanics helps figure out what's not working right. It measures things like joint angles, muscle forces, and how the ground pushes back during movement. These measurements reveal weaknesses or asymmetries that could cause problems later. For example, after an anterior cruciate ligament tear, an injury to the knee, biomechanics can show if the athlete is moving differently. Maybe they're not bending their knee enough or their knees are collapsing inward when they change direction. These issues can increase the chance of re-injury if not fixed. Using biomechanical assessments, clinicians can see exactly where the deficits are. They can then tailor rehab exercises to target those specific weaknesses. This helps restore proper movement patterns, making the athlete safer when they return to their sport. Biomechanics also helps decide when an athlete is ready to go back into play. Instead of just waiting a set number of weeks, the athlete undergoes tests to see if they have regained strength and control. If they move well and show no dangerous asymmetries, they can progress to more intense drills. If not, they stay in rehab longer until they meet those movement standards. This approach reduces the risk of coming back too soon and getting hurt again. For student-athletes balancing school and sports, biomechanics can speed up recovery by focusing on the most important physical issues. It provides clear feedback on progress, which can motivate athletes and help manage expectations. As they move through different stages of rehab, biomechanical data guides a gradual increase in training complexity. They start with simple controlled movements and slowly work up to full-speed sport actions. This step-by-step process rebuilds confidence and physical readiness while keeping injury risk low. In the end, biomechanics plays a key role in making sure athletes return to play safely and effectively. It helps identify injury-related problems, guides personalized rehab, and supports safe progression back into sports. By using these insights, athletes can recover better, reduce the chance of re-injury, and continue their athletic journey alongside their academic goals.